A stroke is often called a brain attack. It happens when something disrupts the blood flow to a part of the brain. Think of your brain as a bustling city, with blood vessels acting as the highways that deliver essential supplies like oxygen and nutrients. When one of these highways gets blocked or bursts, the brain cells in that area are starved of what they need to survive. This interruption is what we call a stroke. It is a medical emergency because, without a steady supply of blood, brain cells can start to die within minutes. The consequences can be devastating, affecting everything from our ability to speak and move to how we think and feel. Understanding this process is the first step in recognizing its seriousness and the critical importance of immediate action. There are two primary ways a stroke can occur, leading to two main types. The first and most common is an ischemic stroke. This type is similar to a plumbing clog. It happens when a blood clot blocks an artery that supplies blood to the brain. These clots often form elsewhere in the body, such as the heart or the large arteries of the neck, and travel to the brain. Sometimes they form directly within the brain's arteries due to a condition called atherosclerosis, where fatty deposits build up and narrow the vessels. In either case, the result is the same. A part of the brain is deprived of blood, leading to cell damage. This blockage accounts for nearly 9 out of every 10 strokes and requires swift medical intervention to restore blood flow. The second type is a hemorrhagic stroke. Instead of a blockage, this stroke is caused by bleeding. A weakened blood vessel in the brain ruptures and leaks blood into the surrounding brain tissue. This leakage creates a pool of blood that puts immense pressure on the brain cells, damaging them directly. It also means that the areas normally supplied by that artery are no longer receiving the blood they need. High blood pressure is a major culprit behind hemorrhagic strokes, as it can weaken artery walls over time, making them more prone to bursting. Another cause can be an aneurysm, which is a balloon-like bulge in an artery that can rupture. Though less common than ischemic strokes, hemorrhagic strokes are often more severe and life-threatening. The causes behind these two types of strokes are distinct but can sometimes overlap. For ischemic strokes, the leading causes are linked to conditions that promote clot formation. Atrial fibrillation, a type of irregular heartbeat, can cause blood to pool in the heart and form clots that can travel to the brain. High cholesterol contributes to the buildup of plaque in arteries, a process known as atherosclerosis, which narrows the vessels and makes blockages more likely. For hemorrhagic strokes, uncontrolled high blood pressure is the #1 risk factor. It puts constant strain on the arterial walls, making them fragile. Other causes include head trauma and the overuse of blood-thinning medications, which can increase the risk of bleeding. Recognizing the signs of a stroke is absolutely critical because time is brain. The sooner a person gets help, the better their chances of recovery. The key symptoms are often sudden and can be remembered with the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services. One side of the face may sag or feel numb. A person might not be able to smile evenly. They may find it impossible to raise both arms and keep them there. One arm might drift downwards. Their speech may become slurred, or they might be unable to speak or understand what is being said to them. Other sudden signs include confusion, trouble seeing in one or both eyes, a severe headache with no known cause, or difficulty walking and loss of balance. When a patient with suspected stroke symptoms arrives at the hospital, doctors must work quickly to confirm the diagnosis and determine the type of stroke. The first and most important test is usually a brain scan. A computed tomography scan is a type of X-ray that creates detailed images of the brain. It can quickly show if there is any bleeding, which would indicate a hemorrhagic stroke. A magnetic resonance imaging scan can also be used. An MRI provides even more detailed pictures of the brain tissue and can identify the damage from an ischemic stroke earlier than a CT scan can. These imaging tests are crucial because the treatments for ischemic and hemorrhagic strokes are very different, and giving the wrong treatment can be dangerous. Alongside brain scans, doctors will perform a physical and neurological examination. They will check the patient's reflexes, coordination, vision, and ability to speak and understand language. This helps them assess which parts of the brain have been affected and the extent of the damage. Blood tests are also important. These tests can check for blood sugar levels, as both very high and very low blood sugar can mimic stroke symptoms. They also measure how quickly the blood clots, which is vital information before administering any clot-busting medications. An electrocardiogram might be done to check the heart's rhythm for signs of atrial fibrillation, a common cause of ischemic strokes. The diagnosis of a stroke is made by putting all this information together: the patient's symptoms, the results of the physical exam, and the images from the brain scans create a complete picture for the medical team. The CT or MRI scan is the definitive tool that confirms whether a stroke has occurred and, most importantly, whether it is due to a clot or to bleeding. This distinction is the critical fork in the road for treatment. For example, a medication that is life-saving for an ischemic stroke could be fatal for someone with a hemorrhagic stroke. Therefore, a quick and accurate diagnosis is the cornerstone of effective stroke care, paving the way for immediate and appropriate medical intervention. Once a stroke is diagnosed, the treatment plan is put into motion immediately. For an ischemic stroke, the primary goal is to restore blood flow to the brain as quickly as possible. The gold standard treatment is a clot-busting drug called tissue plasminogen activator, or TPA. This powerful medication must be administered within a few hours of the first symptoms to be effective. For some patients, especially those with large clots, a procedure called a mechanical thrombectomy may be performed. In this procedure, a doctor threads a catheter through an artery, usually in the groin, up to the brain to physically remove the clot. For a hemorrhagic stroke, the focus is on controlling the bleeding and reducing the pressure on the brain. This can involve medications to lower blood pressure or counteract blood thinners. In some cases, surgery may be necessary to remove the pooled blood or repair the ruptured blood vessel. After the initial emergency treatment, the long journey of recovery begins with rehabilitation. The brain has a remarkable ability to heal and adapt, a quality known as neuroplasticity. Rehabilitation is designed to harness this ability. A multidisciplinary team, including physical therapists, occupational therapists, and speech-language pathologists, works with the patient. Physical therapy focuses on regaining strength, balance, and coordination, helping patients relearn how to walk and perform other movements. Occupational therapy helps individuals relearn the skills needed for daily living, such as dressing, eating, and bathing. Speech therapy is crucial for those who have difficulty speaking, understanding language, or swallowing. This comprehensive approach is tailored to each person's unique needs. The recovery process can be long and challenging, and it is not uncommon for stroke survivors to face complications. These can range from physical to emotional challenges. One common complication is spasticity, where muscles become stiff and tight, making movement difficult. Another is dysphagia, or difficulty swallowing, which can lead to poor nutrition and a risk of pneumonia if food goes down the wrong way. Many survivors also experience chronic pain or fatigue. On the emotional side, depression and anxiety are very common. The sudden loss of abilities and independence can take a significant toll on a person's mental health. Acknowledging and treating these complications is a vital part of the overall recovery plan, ensuring a better quality of life. The goal of rehabilitation is not just to regain lost abilities, but also to empower the survivor to live as fully and independently as possible. This involves learning new ways to do things and using adaptive equipment if needed. For instance, someone with weakness in one hand might learn new one-handed techniques for daily tasks. Support from family, friends, and support groups is also incredibly important. Connecting with others who have gone through a similar experience can provide emotional comfort and practical advice. Rehabilitation is a partnership between the patient, their family, and the healthcare team, working together to rebuild a life after stroke. It is a testament to human resilience and the brain's incredible capacity for recovery. The best way to treat a stroke is to prevent it from ever happening. Fortunately, up to 80% of strokes are preventable. The key lies in managing the risk factors, many of which are related to our lifestyle choices. Controlling high blood pressure is the single most important step you can take. Work with your doctor to keep your numbers in a healthy range through diet, exercise, and medication if needed. If you have diabetes, managing your blood sugar is crucial. Quitting smoking is another powerful preventive measure, as smoking thickens the blood and damages blood vessels. Adopting a heart-healthy diet, rich in fruits, vegetables, and whole grains, and low in sodium and unhealthy fats, can make a huge difference. Regular physical activity is another cornerstone of stroke prevention. Aim for at least 30 minutes of moderate intensity exercise like brisk walking, most days of the week. This helps maintain a healthy weight, lower blood pressure, and improve the health of your blood vessels and heart. Limiting alcohol consumption is also important, as excessive drinking can raise blood pressure. If you have conditions like atrial fibrillation or high cholesterol, it is vital to follow your doctor's treatment plan. Taking medications as prescribed can significantly lower your risk of a stroke. Regular checkups with your doctor allow you to monitor these risk factors and stay on top of your health. These proactive steps are your best defense against a brain attack. It is important to remember that a stroke can happen to anyone at any age, but by taking control of our health, we can dramatically shift the odds in our favor. It is about making small, consistent changes that add up to a big impact over time. Think of it as investing in your future health. Each healthy meal, each walk, and each cigarette not smoked is a deposit into your brain's health bank account. Educating yourself and your loved ones about the signs of stroke and the importance of prevention is a powerful tool. When we are all aware, we can act faster and support each other in living healthier lives. This collective effort builds a stronger, more resilient community. While the impact of a stroke can be profound, there is always reason for hope. Medical advancements are continuously improving treatments and outcomes. Rehabilitation therapies are helping more people regain their independence than ever before. For survivors and their families, the journey can be difficult, but it is one filled with incredible stories of courage and determination. For everyone else, the message is one of empowerment. You have the power to protect your brain. By understanding the risks and embracing a healthy lifestyle, you can build a stronger, more resilient future for yourself, free from the shadow of stroke. The future of your brain is largely in your hands.